pressure of your blood vessels when I take your pressure. Okay? So this is, you can also say this is the filling pressure of your heart. How your heart fills. So there's a lot of heart conditions that affect diastole, or the bottom part of the number. Okay? Things like wall thickness of your heart. Okay? Valve issues of your heart. Okay? People who have pulmonary issues, meaning lung issues, because lungs affect the filling of your heart. So people with COPD, severe sleep apnea, and the worst one is obesity. Okay? The fancy medical term is called Pickwickian syndrome. Okay, fancy word, all right? It just means that your heart has incredible pressure on it, even at resting phase, because of obesity. Okay? Okay, treatment. Some of you I know are on these medications. Okay, there's more medication classes than these, but the main one that most people are on are probably Norvasc. Okay, calcium channel blockers. Okay, they make the blood vessels relax. They lower your blood pressure. Biggest side effect of Norvasc or calcium channel blockers? Swelling, angioedema, fluid collection. Okay. The next one, okay, angiotensin converting enzyme medications, okay, or ACE inhibitors, or ARB inhibitors. Okay, I'm not going to go into too much medical detail here, but the big thing is people who are on, for example, lisinopril, losartan, they can be hard on your kidneys. They can change potassium levels, okay? So usually people who are on those medications need labs at least once or twice a year to make sure things are stable. Your diuretics. HCTC. Yep, makes you go pee. Okay, all right, okay. Hydrochlorothiazide. Triamterene. Some of you are probably on these medications, okay. The biggest problem with these medications, it makes you lose salt. Okay? Because you pee it out. How does water move in the body? It follows salt. When a patient is very sick in the hospital, what's the number one thing that doctors focus on when patients are in the hospital super sick? Fluid management. That's all we really focus on. When you walk in, you see these patients on life support and 10 million different medications. All we're trying to do is manage salt levels and fluid dynamics in the body. Now, obviously a lot more complex than that, but that's what we're trying to follow. Okay? So, biggest thing here, salt levels. You start this medication. Doc, I'm confused. I can't walk like I used to. That's because your body's dumping salt. All right? Hyponatremia is the medical term. Okay? And then beta blockers. Okay? This controls the top part of your heart. It says, heart, slow down, okay? Let me fill up with blood naturally. Let me get my diastolic pressure stable, okay? All right, let me have the heart pull apart correctly, all right? Metoprolol, very common medication. Coreg, or carvedilol, another one. Okay? Sure, I'll go over one more slide and then we'll open up to questions. Okay, go for it.
I was at one time of my life, a few years ago, on the last one, on the metoprolol.
Okay, so you're saying that she was on metoprolol in the past?
I had a very small dosage, but I read about it, and they say it's very bad to discontinue at one time, and you have to go slowly down.
So part of that statement is correct. You can get something called a reflexive tachycardia, meaning that your heart rate goes up if you stop it abruptly. But it's only when people are really high doses for a long period of time. Okay.
Thank you.
Yes, sir.
You mentioned about a high blood pressure. Is there any concern if you're 90 and your blood pressure is 120?
So the question is all right, the studies show that higher blood pressure in the geriatric population, 80 and above, okay, it's beneficial to shoot with a target closer to, I go over 150 over 90, okay, that's my goal, okay? Is it detrimental, meaning is it bad to have low blood pressure? The answer is no, okay, all right? It's only if we force it low, okay? So, think of this concept. You're 85 years old, your blood vessels are not as elastic, meaning not as stretchy, so your body is used to higher blood pressure. So if I lower it, your vessels are already stiff. Are they going to be able to accommodate the change in blood pressure? No. Okay, meaning can they get used to a new low blood pressure? No, because the vessels are stiff. So I'm forcing the body to do something that it does not want to do. And that's where the danger comes. Okay.
So if it just happens, that's okay.
That's okay, because your body is used to that naturally, okay? Or if you've had that controlled for the last 20, 30 years, then it's okay, all right? Now, my favorite slide, I can ask this question to you in here. How many people drink alcohol? Okay, most of you. Okay. Right? All right, the classic is red wine or alcohol beneficial for high blood pressure? The answer is yes, only to a certain amount. Okay? All right? Okay? Some of you, when we talk about a glass of wine, it's different for different people. Okay? All right? So, when we talk about alcohol, alcohol can lower blood pressure and be overall beneficial if it's around 5 ounces a day. Okay? Okay, so I tried to get a picture that shows 5 ounces of wine per day, but usually the common glasses of wine is about a 15 ounce or a 13 ounce glass of wine. Okay? That means that it is well below half of filling up that glass of wine. That's what 5 ounces of wine look like. I can guarantee that 90% of people, when they have a glass of wine, it is more than 5 ounces. Okay? All right. So, if you drink more than 5 ounces of wine, it has a tendency to increase your blood pressure. Okay? All right, so the benefit is lost. So, yes, the common train of thought is, oh, red wine or alcohol is good for me. Yes, again, to a degree in moderation. All right? Also, blood pressure. This is an important concept that I want to make sure everyone understands. A low salt diet, okay? A lot of you, some of you in this room even, are very good at having low salt diets. Some of you are too good at it, okay? Because what happens is that, especially with some of these medications that you're on, such as diuretics, is that if you lower your salt too much, guess what's going to happen? You're going to drive your salt levels too low, and you're going to have a negative consequence of having a low salt diet. Okay? So, around 2 grams of salt per day is considered a low salt diet. Okay? So, a lot of people, what they do is that they have a 0 salt diet and they use non-salt substitutes, okay, potassium chloride, for example. And what happens is their body loses salt and then we run into trouble. Okay? Lifestyle, physical exercise. All of you, to your ability, need to be doing physical exercise on a daily basis. Okay? Now, this does not necessarily apply to some people that actually made it down here today. Unfortunately, there are some of your colleagues that self-isolate in their rooms. Okay? All right? And so, if you don't have exertional cardiac activity, meaning if you don't get your heart rate up, and if you don't have a certain degree of impact or weight-based activity, okay, you're gonna lead to possibly increases in blood pressure. Okay? All of you are at important parts of your lives where you still need to focus on your health. Okay? You still need to focus on eating right, not consuming too much alcohol and physical exercise. Okay? I know some of you are 90 already. We want basically, the overall goal, guys, is to live every year healthy. And then, if you do pass away, it is a painless and peaceful process. Okay? So that's my goal. All right? So you cannot give up on health in your later years of life, or it's not going to add to your comfort. Okay? Okay, I'm going to stop there, and then what I want to do now is just have a roundtable discussion and conversation. And if you guys want to ask any other questions, feel free to do so.
Exercise. What should you get your heart rate up to?
So the question was exercise. What should you get your heart rate up to? Okay. Yes. So that's a very good question. So there's no exact answer or routine answer. What I would say is that take your resting heart rate. Let's say it's 50 or 60, and try to exert it at least 20% higher than. So your resting heart rate is around 60 to 70. So 20% increase beyond resting heart rate without symptoms. That's the minimum level, okay? So for you specifically, I would say get your heart rate up to at least 80 or 90 without complaints of severe shortness of breath, okay? If you're asymptomatic at that point, then you could go to 100 to 110, okay? Okay. Other questions?
What if blood pressure that's normally between 140 over 60? What does it mean that it comes one time at 190 over 100?
It's a good question. So, in terms of blood pressure management, okay, and blood pressure optimization, people will have spikes in blood pressure, okay? All right? So,
if they are relaxed.
yes, possibly, okay? There's a lot of different reasons for that. One thing that I do want to mention, you made a good point, is that your subconscious controls your blood pressure to a very high degree, okay? And what I mean by that is that certain people, if you check your blood pressure too many times, okay, you can theoretically cause a spike in your blood pressure. That's for some people. I'm not saying that's your case, that's just in general. So a lot of times I recommend only checking your blood pressure once a day and then random times throughout the day, okay? You can easily subconsciously train your blood pressure to be too high and as well as too low. Okay? That's been very clearly shown. In terms of the spikes of your blood pressure, it is normal to have a certain degree of spikes in your blood pressure, okay? And there's a whole host of reasons. The problem is that if you have controlled blood pressure or low normal blood pressure 95% of your life and it spikes up 5% of your life, it's very hard to control that because you do not want to lower your baseline 95% of blood pressure readings. Sometimes when you have spikes in blood pressure, it has to do with how your heart is actually beating. So therefore, we switch to medication that control your heart rate rather than your pure blood pressure. I know that's a complex statement there. Other questions? Exercise. Don't drink too much. Don't be overly concerned with your blood pressure in getting it down to 120 over 80, okay? That was the thought process a while back, but now I would say, if you want to be conservative, 140 over 90, okay? I work off 150 over 90, all right?
What is 135 over 70? between 60 and 70 all the time.
So that's a perfect number. As long, we're talking about forcing blood pressure to do what it's supposed to do. So if you have a normal, low normal blood pressure, that is okay. So some of you have heart conditions and your blood pressure normally runs 100/70. That's fine because that is your body. What we're really talking about is goals, because a lot of people are concerned that, oh doc, my blood pressure is 145/75. That's okay. I'm not going to start you on a bunch of blood pressure meds to drop it down to 120/80. I will be hurting you instead of benefiting you.
Does atrial fib have anything to do with this?
So atrial fibrillation, the question was, does atrial fibrillation have anything to do with this? So I know some of you have atrial fibrillation here. Atrial fibrillation, that's fine, affects the top part of your heart. It reduces the filling pressure of your heart by 10%. Hence, your diastolic pressure is usually lower, okay, than a normal person's.
That's why it's 1.5.
Yes. Okay? So, you have a quivering of the top part of your heart, your atrium. Okay? So, when the top part of your heart quivers, it can't push blood sufficiently to the bottom part of your heart, and the bottom part of your heart has a less volume load of blood to push to the rest of your body. Okay? So, you usually have a little bit of low normal blood pressure. What's one sign of uncontrolled atrial fibrillation? Lightheadedness or near passing out events. Near syncopal events, okay? That's because you have low blood volume, you have stiff vessels, and you can't get all that blood flow to your brain. Doc, I've been feeling a lot more tired lately than I usually have, or, I almost passed out for no reason, but doc, I'm drinking a lot of water. Well, let's look at your, do an EKG, and let's see what your heart's doing. Classic signs. Other questions? Yes, ma'am.
And how high do you get worried? When your blood pressure is way up?
Okay. So, anything above systolic, above 180, in triple digits on the low numbers. Okay, 180/100. Okay, but sustained. Meaning for a prolonged period of time. So we have to be very careful if you have a blood pressure that lasts only a couple of minutes, we need to associate it with other metabolic issues, okay? We have to also associate it with what's going on at that point, okay? All right? Also, mental health as well, the controlling the subconscious. Are you anticipating a high blood pressure, so on and so forth, okay? But if you have a sustained blood pressure of 180/100, you increase your risk for stroke, heart issues, kidney failure, so on and so forth. So yes. The biggest threat to blood pressure, to be honest, is sometimes high spikes that we don't know the reason why. Because that's a drastic change.
And what do you do then?
Well, so that's like, we do a lot of things. It's just depending on what the issue is. So for example, if you keep on having periodic spikes in your blood pressure, we make sure that physically nothing is going on, okay? Are you having, renal artery spasms? Are you having a thyroid issue? Do you have a pheochromocytoma? All these other medical conditions that we work up through your blood and through ultrasound, okay? Then we also make sure, sleep cycle, okay? Do you have undiagnosed sleep apnea? Okay, are you obese? Are you skinny? What medications are you on? How's your diet? Are you introducing a big salt load into your system? What's your mental health like? Are we doing anxiety, depression? Are we missing that? Are we not asking the right questions? So that there's a lot of different pathways that we can take.
I keep coming back to the 190/100, which just happened to me 3 nights ago.
Okay.
And which was just a slight pain next to my heart. I was watching peacefully M.B.A, which I was very enjoying. And suddenly when I felt that, I said, oh, let me go.
Sure.
Check my blood pressure, it was 190/100.
Okay.
I called Charles King. He he stood by me for a few minutes, then it stayed the same, an hour later it went down a little bit.
I think you and I can talk.
What is that?
What there's that's not an easy answer to answer. I don't have a magic wand. I wish I could answer.
It's going to be checked tomorrow by lawyers. But
Sure.
the fact is, it happened out of the blue.
Right. We'll talk in private, and we can kind of brainstorm together because I also have your chart too, so we can open up and review it together. No problem. Okay. Yes, ma'am.
I have AFib. I've had it for a number of years, and it started when I felt fluttering. They put me on medication. I think the Eliquis might be the thing. Right, I'm still on it. And my blood pressure is usually way less than 150. It could be 120, the top one. That's okay for somebody with, I don't feel the fluttering anymore, by the way.
Yes, that is okay. So the whole point is if you have, it's the range from 120 to 150 as the top number, okay? We do not need to be overly concerned about controlling those numbers,
Okay.
okay? So that's the big point here. Especially with people with atrial fibrillation, your filling pressures, meaning blood pushing from the top part of your heart to the bottom part of your heart, is reduced, okay? So if you are even in the 160 range, I would, let's say you were, I would not necessarily be overly concerned because your body functions on a slightly higher blood pressure because of atrial fibrillation.
Okay. But it's gotten me into my 90s, so I can't really complain.
So keep on doing what you're doing.
97.
Yes,
Just 97, yeah.
yes, perfect. Keep up the good work, okay? All right? Don't let anybody mess with your body, all right? Whatever you're doing is perfect, okay?
It is.
All right. Unless there's more questions, I'm going to wrap this up. Or another question?
How does an extra beat affect your blood pressure?
Okay, so some people have premature atrial contractions or premature ventricular contractions, okay? So that means that either the top part or the bottom part of your heart gets confused and doesn't pump as efficiently when it goes bump on the bottom part when it's supposed to go bump, okay? You might have a transient dip in blood pressure, but you should not feel it, okay? So what does this mean? If you do feel it, we need to give medications to control those extra beats either on the top part or the bottom part of your heart. But having extra beats, I would say almost everyone in this room has extra beats at this point of their lives. Your blood pressure, by having just one quick extra beat, is not going to drop, all right? However, some people with stiff hearts or thickened heart walls, it can affect that, so that is a whole different conversation. So the short answer is no and yes. Okay? You gotta remember, medicine is not black and white, okay? This is why we go to school forever. Yeah. Okay, we're gonna wrap it up. I'll be in the back with Patrick. If you guys have any other questions or want me to repeat anything, I'll be in the back.
Perfect. Thank you.